The Doc is In is sponsored by Amada Senior Care.
Well, I'm not sure we can answer Justin's question this morning, but we can certainly answer questions about this new vaccine study and its findings. Glad to have Dr. Ryan Stanton back for another segment, diving a little deeper into what we talked about last half
I
hour.
talked earlier about some of the study itself, but I want to talk about some of the balance that we have. So earlier we did talk about the recent released study on the COVID vaccine risk from the Global COVID Vaccine Safety Project in the journal Vaccine. Now let's talk about some of that comparative risk of the vaccine and the virus. This study looked at the three major areas of consideration, including neurologic, hematologic, and cardiovascular side effects. The key take-home is that most were mild and self-limited conditions. The study may scare some from getting the vaccine, but the comparison of the vaccine versus the infection showed that neurologic complications are 617-fold more common with the virus than the vaccine. The risk of myocarditis is nearly twice that with COVID than the vaccine, and other neurologic conditions like Guillain-Barré are 15 times greater with the virus than the vaccine. I would love for us to not to need the COVID vaccine, love for COVID to go away, but here it is. But when faced with viral pathogen, there's a risk and benefit of the best tools we have, which are prevention. Even though the overall risk of COVID, including hospitalizations and death, have decreased, we're still seeing very sick people, long COVID, and even deaths. The vaccine and will continue to be a method to prevent complications and save lives, especially among those that are higher risk for complications. So the key to keep in mind is now, as we move into this phase of COVID-19, is balancing that risk and benefit based on your age, risk factors, and other contributions. So with young children, maybe it is something we're a little bit softer on, but for those over 65, especially those with lung disease, things like that, definitely still need those boosters to stay up to date.
I don't think I've ever asked you this question, even off camera, and I'm curious, maybe a dumb question, but hear me out. It seems like, and I know personally, the COVID vaccine walloped me a lot more than any other vaccine I've ever had. Why is that?
And that stimulation of the immune system, that's the way we're going to make that immune response, especially with something that us as humans had not been exposed to before. So stimulating the immune system to be able to fight it back later, and that's where some of these side effects come from, is because the immune system can't really tell the difference.
Wow. All right, great information, and again, great to have you back from Daytona. Of course, you're not staying in town long, are you?
Nope, NASCAR keeps on traveling. We're rolling into Atlanta this weekend, and then we're going to head off to Vegas for a little desert racing.
Nice. Well, safe travels.
Thank you.
And we'll see you in studio soon, I hope.
Appreciate it.
All right, that's Dr. Ryan Stanton, our Chief Medical Contributor. We're back with What Day Is It? That's coming up next.